How to treat severe acute virus infection effectively.
I am Fencer Wang, a physician of Cha'an Clinic of Taiwan, Kaohsiung. Why the infectious disease is so difficult to treat? The most important reason is the medical specialists don't clearly understand what the immune system really works. The crucial mechanism for immune reaction is misunderstood. The myth is that the immune system controls synthesis and supply of purine and pyrimidine, and then controls the replication of virus. I'll show you later. If you are a common person, you don't have to realize complex mechanisms. What you need to know is the following. 1. The most effective method is fast. Only drink Lysol water for 72 hours. 2. The compromised method is only drink Lysol water added with light sweet sugar for 72 hours. 3. It should start as early as possible and best in the very beginning when the disease symptom occurs. The first symptom may be fever or runny nose or sore throat or cough or general malaise or general soreness or sleepiness or oversleep. 4. If you are a pregnant woman, suggest receive the compromised method. 5. If you are a diabetes mellitus patient, suggest receive the compromised method and reduce your DM medication dose to half or less. 6. If you cannot but require high energy intake, suggest receive compromised method with increasing sugar amount. 7. Any nutrient contains proteins or amino acids can't be ingested or injected. 8. Antipyretic is not recommended. Steroid is prohibited. Remind again, no protein and endure hunger for 72 hours. What's wrong with current treatment? Supporting treatment must be modified. Under primary thinking process, in order to strengthen our immune system to perish the viruses, we need larger amount of protein to supply immune system for immune reactions, immune cells reproduction, and antibodies production. Medical specialists may try to increase patients' protein intake. Antipyretics, NSAIDs, moreover steroids, all have the ability to lower fever and alleviate disease symptoms. Patients become less poor appetite, nausea, and vomit. If above medication fails, the specialist may take incubation to infuse nutrients into stomach. And if tube nutrition fails too, TPN, total parenteral nutrition, would be set up as long as patient can afford it. What you don't know is protein nourishes not only immune system but also virus. Finally, both immune system and the virus become very strong and the disease becomes very worse. There is a relationship between protein and virus. Protein can be decomposed to amino acids. Amino acids can be used to synthesize purine and pyrimidine. Purine and pyrimidine can be used to synthesize DNA and RNA. DNA or RNA can be used to assemble virus. Theoretically, if there is no protein, there is no virus. However, protein is a very important nutrient for body. We can live without protein. Just see how immune system performs perfectly with this relationship. While in infection, immune system takes over the place of brain to manage the nerve, hormone, physical, and biochemical activities via secreting cytokines. The key step is the supply control of purine and pyrimidine. To get this purpose, the digested and absorbed purine and pyrimidine are degraded directly in intestine and liver. The body doesn't use purine and pyrimidine obtained from food. With few exceptions, the unique supplier of purine and pyrimidine body is liver, which can proceed with de novo synthesis of purine and pyrimidine. The raw materials are amino acids. De novo synthesis of purine and pyrimidine is very expensive, for it consumes many molecules of amino acids and ATPase. You may notice that the body spares usage of absorbed purine and pyrimidine but uses those made luxuriously, so it must imply important evolutionary meaning. Its purpose is to control infection disease, especially virus infection. After infection, the immune system secretes certain cytokines to make you anorexia, nausea, and vomit to prevent nutrients intake. It also increases energy expenditure, especially when fever. Moreover, it blocks usage of backup energy, lipid, and triglyceride. Inhibition of energy intake, increase of energy expenditure, and blocking usage of backup energy. Hence, blood glucose is largely consumed. Under strong effect of stress hormones, the composition of body proteins, mainly muscles, maintains serum amino acid levels. Body cells can take those amino acids to keep function normally. In liver, captured amino acids are massively led to synthesize glucose, triglyceride, and acute phase proteins. The synthesis of glucose is particularly important. It is made more than used. Serum blood sugar level continues to elevate. When its concentration gets higher than 180 mg per deciliter, it begins to lose by urine. Above procedure ensures captured amino acids in liver continue to make and replenish glucose, which is largely exhausted. Hence, purine and pyrimidine are difficult to be synthesized and the virus is hard to be replicated. By the way, the elevation of serum blood sugar stimulates the secretion of insulin, and the insulin in turn inhibits the decomposition of lipid. Uses amino acids to produce triglyceride is incredible too. Normally, the excessive ingested nutrients are there to make triglyceride, but in acute virus infection, the nutrients intake is poor, while liver cells reversely use amino acids to synthesize triglyceride. When nutrients intake is poor and its usage is blocked by inhibiting lipoprotein lipase, its purpose is also to exhaust the amino acids captured by liver cells and ensure those amino acids not to synthesize purine and pyrimidine. Thereafter, triglyceride, lipid, and ketone bodies can be energy source as in starvation. Ingestion of larger amount of nutrients in acute stage of virus infection. Those absorbed glucose and amino acids are transported via portal system to liver. That makes high concentration of them in liver. Biochemical reactions in liver cells of using amino acids to produce glucose diminished, and there are more amino acids left to execute de novo synthesis of purine and pyrimidine. Virus will replicate massively and the disease will be worse. Ultimately, immune storm or secondary bacterial infection may happen and the patient may be in danger. How amazing the immune cells have the ability to de novo synthesize purine and pyrimidine for their own use. So, they can reproduce, function, and produce antibodies normally. Fast in early stage of acute virus infection makes virus replication limited, but the normal function of immune system. As to get over the pandemic quickly and effectively, it needs a powerful leader of country or world to force all civilians to execute the method mentioned above at the same time for 72 hours. The pandemic will quickly come down. However, it won't disappear completely, for there may be some technical problems, and there are always people who won't obey the rules. However, only sporadic cases remain and can be treated with the above method. Evolution has been telling us infected animals which do not like to eat survive the disease and exist after the long-term evolution. Thanks for watching.